Welcome to our Childhood Cancer Advocacy Hour in California. We are so thankful that you are here today with us. I'm just going to do some housekeeping notes and then we're going to officially get started. So to begin, there is a chat function that is open to you. So we ask that as we go through the programming today, if you have questions, or comments of support or things like that that you want to put in there, please use the chat as we go through. And then at the end, we will be able to hopefully answer any questions that you have, with our panelists today. Also at the end, my coworker Jessica is going to put in the chat a link where you can take action in your area with your legislators, based on what you're hearing today. So we will be providing that link as well as we go throughout today. So I wanted to get started. Thank you for joining us again. And we're here today regarding childhood cancer in California. I'm representing the American Childhood Cancer Organization. I'm Aubrey Reichert-Eline, Director of Corporate and Community Engagement. The American Childhood Cancer Organization is known as ACCO, which is a national childhood cancer organization. I really want to thank Senator Rubio for championing this and for the collaboration of her team and all the sponsors of this bill, for this bill, SB 934, as well as for the budget ask. I'm honored today to have Senator Rubio here, as well as Assemblywoman Rubio in support of this initiative. So thank you so much. I'm also here on behalf of the childhood cancer community, and I want to thank the childhood cancer parents, warriors, advocates that we have with us today and that have been with us throughout this initiative in California. On April 8th, 2018, my family was not a cancer family. On April 9th, 2018, we were. That's when my then 9-year-old daughter was diagnosed with a brain tumor. Her name is Grace. She traded in her softball glove and her gymnastics uniform for many rounds of chemotherapy and radiation. She's currently showing no evidence of disease, and for that, we're very thankful. She deals with side effects every day, and we're here to pay it forward so that there are less toxic treatments and better treatment options for the childhood cancer warriors in California and beyond. We're dedicated to helping these families in this fight. Cancer is not something you want in your vocabulary or in your home, and especially not with your child. The majority of cancer research funding at the federal level goes to adults. We at ACCO say, what about kids? Pediatric cancer is the #1 death by disease in children in this country. California is number 21 in the country in terms of pediatric cancer incidence rates, and California ranks #1 in childhood leukemia incidence rates. We can do better for them. These stats are coming from a June 2018 CDC report. States do have the unique opportunity to make up the disparity in pediatric cancer research funding. ACCO has taken the lead on securing funding in several other states. We have success in Pennsylvania, New Jersey, Kentucky, and most recently, Maryland. The money raised at the state level stays in the state level and benefits the institutions doing research in California. The appropriations that ACCO has secured in the last year in just 3 states, New Jersey, Kentucky, and Pennsylvania, equates to $30 million, which is the same as what the Federal STAR Act has been able to provide. We know that California can lead this country in implementing state funding for pediatric cancer research. Together, we can make a difference for these kids and fund more research so that there are less toxic treatments and more survivors. We can also protect those that survive from pediatric cancer, protect them from a lifetime of side effects. My life is forever marked from before cancer and after childhood cancer. I'm thankful that my daughter gets an after, and I'm determined to make a difference for others. We're here today to make an impact for those fighting and those that will be fighting in the future. I'm here today for Grace, for Andrew, for Layla, for Leanna, for Scout, for Owen, for Joey, and for all the children that will be diagnosed with pediatric cancer this week in California. I hope that we can make a difference together and support SB 934, which will set up a pediatric cancer research fund, the Andrew Hirschman Pediatric Cancer Research Fund, as well as budget appropriations to support this. Thank you. And I'm now going to turn it over to our champion, Senator Rubio. Let me give you a quick introduction of Senator Rubio first. Senator Rubio was elected to the California State Senate in 2018. She represents Senate District 22. Previously, she was a public school teacher for 17 years in Los Angeles County and was an elected official for 13 years in the city of Baldwin Park. Since entering the California legislature, Senator Rubio has been a strong advocate for cancer patients. Aside from SB 934, she successfully passed SCR 11, establishing the Cancer Patients Bill of Rights, and a bill to create a cancer medication recycling pilot program that provides cancer patients with safe, affordable access to life-saving medications. She is also an internationally recognized domestic violence advocate, passing groundbreaking legislation protecting victims. The first Latina chair of the Senate Insurance Committee, Senator Rubio is part of the Senate leadership team and chair of the Senate Select Committee on Domestic Violence. She is also co-chair of the Senate Wildfires and Climate Change Resiliency Group and a member of the Senate Housing Group. She's a committee member of Health, Energy, Utilities, Communications, Transportation, Governmental Organization, and the Joint Committee on Rules. Senator Rubio is born in Juarez, Mexico, and is the proud daughter of a former bracero worker and housekeeper. We are honored to work with her team and honored to work with Senator Rubio on this initiative. So I'm going to turn it over to Senator Rubio.
Good morning, everyone. Thank you so much. First of all, I'm honored to be here with so many of the mother warriors and father warriors out there who have battled cancer one way or another with their children. And I'm especially proud and privileged to be the author of SB 934, which is a California Childhood Cancer Research Fund Act. As already mentioned, cancer is a leading cause of death by disease for children in the United States, and child cancer patients face different challenges than adults. 20% of children diagnosed with cancer will not survive. And yet I feel that we haven't put the spotlight and focus on childhood cancer as much as we should. And when these children do survive, many of them risk lifelong side effects with cancer medication that will negatively impact their health and well-being. I was a teacher for 17 years and I saw a few families struggle, go through cancer with their child. And even when they came back to the classroom, some of them, I remember a little boy who had lost his eyesight and other challenges. And it breaks my heart because we know that we need to do more for our children. But despite the challenges, there's very little funding for childhood cancer research. Less than 4% of the federal budget for cancer research goes to childhood cancer. And that is why it is critically important that we pass SB 934. And with all of our help here today, I hope that we can get this done. So SB 934 would accelerate California progress in the fight against cancer by establishing the $50 million Andrew Hirschman Childhood Cancer Research Fund. There's a lot of families here, and I just want to say thank you for being on here and sharing your story. We're going to get to hear from Andrew Hirschman's mom, who's here with us today. And, you know, I also wanted to commend the American Childhood Cancer Organization for partnering with me. They already expressed some of the bills that I worked on with them already, from the Cancer Patient Bill of Rights to the Cancer Medication Recycling Program, which is really important. In California, we didn't have that type of program. And I met a husband who had approximately $11,000 worth of cancer medication that his wife received after she had passed from cancer. So clearly there's a lot of need in this space. And I'm always happy to partner with all of you to make sure that we continue to push the needle and make sure that we're passing legislation that helps us make treatment better for everyone, and that, you know, our children, when they do survive, they have what they need to live a long, healthy life. So again, thank you to all the mothers and fathers who are here with me today, and all the, the providers, those medical doctors who take the time to take care of our children and patients. And I've seen firsthand how thoughtful and engaged they are in making sure that parents feel comforted in that time of need. So again, thank you to all of you. And again, I have my dear friend, Elke Hirschman, who's here today, who's child, Andrew Hirschman, passed recently, and I decided to name this bill after him. So thank you, Elke, for joining us today. So again, we know that we need to do more for our families impacted by childhood cancer. And this is why, in honor of Andrew, I have named this the Andrew Hirschman Childhood Cancer Research Fund. The new research grant program created by SB 934 will be administered by the University of California, similar to the breast cancer research program that they're doing right now. So thank you to them for wanting to join our efforts. Qualifying research institutions can now apply for this grant funding to support the research. We're going to focus on the causes, prevention, treatment, and anything else that we can do to make this better. SB 934 has strong accountability provisions to ensure that the research funding is awarded wisely, including an annual reporting requirement summarizing the research projects that have been funded and its successes. So of course, if we want to continue to push and get more funding, we want to make sure that it yields good results. And again, we're here to support and continue to ask every other year after that to see if we can continue to fund it with even more money. So thank you. To all my colleagues in the legislature, I also want to thank them for being supporters. They did support my cancer medication recycling program, and they've been doing their own policies that I've actually co-authored. So to all my fellow assembly members and senators, thank you for your partnership. And so again, we're here because this is an issue that affects everyone. Some of the policies that we've passed have bipartisan support. So it really doesn't matter who you are. It touches everyone. My grandfather personally, he passed away from cancer. We have a lot of family members on my father's side who are currently going through treatment and have passed due to cancer. So we know that at some point in your life, you will know someone, meet someone, or have a family member that will be challenged by this awful disease. And hopefully we can find solutions. And with this funding program that we're putting forward, that's where the research is going to be needed. And hopefully we can save some lives and make it better for children in the future. Right now, we're focusing on making sure that we pass it in the legislature. And so this is a call to action for all of you on this webinar to mobilize. Right now, we are currently going through the budget with the governor, the state assembly, and the Senate. We have to make the deadline by June 15. And so right now the discussions are going on, and it is critically important that today, if you can, you reach out to your senator and assembly member, let them know that we have SB 934 that's going to be coming to them. That's one piece of the puzzle. The other piece is making sure that they also fight for the $50 million that's going to make this bill effective. So again, please call them today and let them know that SB 934 will come to them on the floor, first in the Senate floor, then it will go to the Assembly floor. And but again, the budget is one piece that must be part of this conversation. So I really do need your help. You can email or you could call or you can visit their offices right now. A lot of them are accepting visits. We've opened up after COVID. So we thank you for that advocacy and meeting with the American Childhood Cancer Organization members and hearing their stories. It's really impacted me, and I hope that impacts you when you hear these family members talk about their loss and their struggle and what they've gone through, because only together we can make this better for our children, our families, and our warrior fathers and mothers who are here with us today and listening. And my heart goes out to any of you that have lost family members and also those that have stories of survival, because I've also heard challenges. And again, that's what we're trying to do, make it better for everyone. So thank you for your time and thank you for your advocacy. And I look forward to seeing each and every one of you in the future. Thank you. And I'll turn it over to you now.
Thank you so much, Senator Rubio. We are inspired by your action and excited to be a part of it today. Thank you so much. Next on our list, I'm actually going to introduce Assemblywoman Rubio as well, Senator Rubio's sister, Assemblywoman Rubio. Assemblywoman Blanca E. Rubio represents the 48th Assembly District in California. During this year that has held struggles for her constituents, Assemblywoman Rubio has held food drives, PPE giveaways to healthcare facilities, and fought hard to pass legislation like AB 323 to protect local journalism. In the 2018-2019 California state budget, Assemblywoman Rubio supported record investments in schools and universities. Responsible for funding the Rainy Day Fund and combating homelessness and poverty, she's authored bills that help children in foster care and assist immigrant communities. As a former educator, Assemblywoman Rubio fully backed additional funding for K-12 schools to help make college more affordable for California students and increase childcare funding. As chair of the Assembly's Select Committee on Domestic Violence, she pushed for a significant fund investment in services for domestic violence survivors. She was able to set aside $10 million to invest in services for survivors and another $10 million for temporary housing solutions for survivors fleeing domestic violence. Assemblywoman Rubio was elected to the Assembly in November of 2016. In Assemblywoman Rubio's first year, she immediately made an impact with 6 of her bills signed into law. And in her second term, she had an impressive 12 bills signed into law by Governor Brown. During budget negotiations, she obtained millions of dollars for San Gabriel Valley transportation projects. Prior to serving in the Assembly, Assemblywoman Rubio spent 16 years as a public school teacher and 20 years in elected office, serving on the Valley County Water Board and Baldwin Park Unified School District. She's a proud mother of 2 children. Assemblywoman Rubio was born in Juarez, Mexico, and came to the United States with her parents at a young age. She received her bachelor's degree in business administration and a master's degree in education with a multiple subject teaching credential from Azusa Pacific University. Assemblywoman Rubio, we are honored to have you with us today.
Thank you. Thank you so very much for having me here. And you know, I wish that I wasn't here to have to advocate. I wish that these important budget requests were automatically done. Unfortunately, that's not how it works. I love what I do now. I was a public school teacher for 16 years and saw again the effects of you know, just what cancer does to families. And I sit on the budget sub 1 committee, which is Health and Human Services. So I hear these stories all the time. Now, the good news that I want to talk about is the state is projected to have over a $60 billion surplus. Now, the bad news is that the state is receiving over a $60 billion surplus, which means that all kinds of organizations, worthy organizations, will be asking for funding. So what we're here to do today is to make sure that the cancer research for the pediatric cancer research gets that funding. And so I cannot stress enough how important your advocacy is for this funding. May revise, which is when the governor revises his January budget to include actual money received, not just projections, is this week. As Senator Rubio stated, the budget has to be passed by June 15th, which means we don't have too much time to start to advocate for the funding. So for me, as a member of Sub 1 Budget Committee, this is where part of the requests go through specifically for the research project. And so what I want to tell you is that your voice matters. We in the legislature, we have 80 assembly members and 40 senators. Everybody has priorities. Everybody's going to be submitting their requests, and obviously they're going to focus on their own district and their own priorities when it comes to the budget. But how you can be helpful is by advocating, calling, emailing, and visiting. And I try to talk to advocacy groups and tell them how critical this is. Sometimes we feel that the legislators are in their own world. You know, Sacramento is really far away from your home. And so we think things are happening up there that we cannot change. Well, as a sitting member now for 6 years, I can tell you that the groups that come and visit, the groups that call, and the groups that email are the ones that I always focus on. To me, this means that we have a group of folks, they want to make a change. And I want to stress that your advocacy is so important. I want to acknowledge my dear friend, Hirschman, who is here today. She can tell you her story, but her son was my son as well. She's my best friend. And I saw when Andrew was born and I was there when he passed. And even though the advocacy and the money is invested, doesn't mean that it's going to get to the right places. Senator Rubio stated that the majority of the cancer research money goes to the adult programs. Well, that's not right. Children suffer this, but we all assume because kids are, we've all heard it, they're young, they're strong, they're gonna get through this. Folks don't necessarily emphasize the need for this research for the pediatric community. And so I want to again stress how important your advocacy is today. I want to thank my sister, Senator Susan Rubio. I'm a huge fan for two reasons, because I know her, but because I know the quality of work that she's done over the last 4 years, her advocacy, her tenacity to advocate for issues that are important doesn't go unnoticed. She is my champion, my senator, but also, again, the strongest person I know in the legislature. And I know that with your help, with your advocacy, we can help Senator Rubio with SB 934 as well as the budget ask. There are two separate things. The bill has until the end of July to be able to pass, but the budget request has to be in and has to be advocated for before the June 15th deadline. So again, thank you for what you're doing. Thank you for having me here and being able to speak to you. But if there's anything else that I can do, please let me know. I am pretty vocal in the state legislature, and I can carry the water for a lot of these issues. And this is such an important issue that I need you to know that you call and I will jump to action, but I also want you to jump to action for our kids. So thank you again for having me. And I look forward to this battle together. Thank you.
Thank you so much, Assemblywoman Rubio. We are honored also to have you with us. Great Rubio team here. Thank you. I just wanted to friendly reminder that there is the chat. So if anyone does have questions as we go, please feel free. We'll put them in there. We'll make sure that we get to everything at the end as best we can. So next, I'm going to introduce Elke Hirschman. Honored to have her with us. Again, as Senator Rubio and Assemblywoman Rubio mentioned, this Pediatric Cancer Research Fund or Childhood Cancer Research Fund is in honor of her son, Andrew. So Elke, I turn it over to you. Thank you so much for being here with us.
Well, thank you. It's really an honor to represent the many parents that get affected by this. So, when you hear the words, Hail Mary, you typically associate that with a final football pass, in hopes of winning the game. Unfortunately, these were the words we heard with our son Andrew's final treatment only 13 days after he was diagnosed with acute myeloid leukemia. Andrew was a healthy young man, a senior in high school, receiving college application acceptance letters, and he had planned to study cybersecurity, an area we all need to protect our corporations and governments with. He played 3 high school sports. He had annual physicals, went to the gym 5 days a week, rarely had a sickness his entire life. Unfortunately, on December 17th, Andrew felt sick and struggled with pain near his spleen. At the time, we actually thought it was COVID because he was having a hard time breathing. Several hours later, we received the life-changing words to us that your son has some kind of blood cancer. As many parents would be, we were in shock and we really didn't know what to do. We were referred to the wonderful hospital of Chalk, and after rounds of blood tests, we were told that Andrew had AML and needed to start chemotherapy immediately. We sought opinions. We were lucky to know other people in the medical community, and we got the opinions of City of Hope and Cleveland Clinic, 2 outstanding hospitals in the search of research of cancer. And they had both agreed with the path of treatment for Andrew for his AML. Andrew completed 8 days of chemo, but his lungs looked foggy, his breath was irregular, and his body was not producing platelets. We found out as a family how important platelets are. The doctors didn't know what to do. They tried one last treatment, the Hail Mary, that they thought could help jumpstart our son's good blood cell counts. Unfortunately, like many other cancer treatments, they are not all effective, and the side effects can be equally dangerous. Honestly, as a parent and a very well-educated parent, I was shocked at how many things I signed in regards to the ramifications that the treatment may have with my son. On the 14th day after Andrew was diagnosed, he had a blood clot develop in his brain. And because his body wasn't producing platelets, the clot didn't stop and we lost our son on December 31st. AML is a rare blood cancer, not often found or diagnosed in children and teens. Unfortunately, during that short period of time of my son having it, we heard of 2 other children that also had leukemia. Unfortunately, 2 have passed away since then. It is considered an adult leukemia, what Andrew had, and as you can assume, not much research or knowledge is known about AML in children, but there is a rise of cancer in general, particularly leukemia in California being diagnosed, and other cancers as well. And there is simply not enough research to provide viable options to save our children. Please support and pass SB 934 and the funding that we need for more research on pediatric cancers so that no other parent, grandparent, sibling, or friend has to hear that the Hail Mary didn't save the child that they love. Thank you so much for having me here today. I really appreciate that I was able to share Andrew's story.
Thank you so much, Elke, for being here and sharing Andrew's story. And we're honored to work in his honor and in honor of all the kids fighting childhood cancer and get this bill passed as well as the appropriation. So thank you so much for sharing that. I'm going to turn it over now to Dr. M. He does a way better job at presenting his name than I will. So it's Dr. M, who is Chief of Pediatric Hematology Oncology at UC Davis Children's Hospital, UC Davis Comprehensive Cancer Center. Dr. M is also the chair of the UC Kayak program, which is the University of California Children, Adolescent, Young Adult Cancer Consortium. He's a fierce childhood cancer advocate, and we're honored to have him speaking with us today on the benefits of research and why we need this in California. So Dr. M, I turn it over to you.
Sorry, thank you. I would like to start by thanking Senator Rubio, Assemblywoman Rubio for the support and pushing this SB 934 forward, because we need a lot of support fighting pediatric cancer. I am a very, very lucky person because I have the honor and the privilege to work with these little fighters and in partnership with their parents. It's a very difficult journey, but I come here every day. And it's just fantastic to be able to serve and work together with these parents and work for these children. So I'm here today to talk about childhood cancer and why it's so important that we get the support and we move forward in the support of cancer research in California. As you heard today, childhood cancer continues to be the leading cause of death by disease for children and adolescents in the United States. Despite of the advances in treatment of childhood cancer have led to remarkable improvement in outcomes over the last decades, with a 5-year survival rate increasing to over 80%. However, despite of these improvements, childhood cancer rates continue to increase yearly. So further research is needed to improve treatments and outcomes of children and adolescents, like, for example, Scout, from whose mom you'll be hearing later this morning. Also, this is particularly important because not all children have equally benefited from treatment progress, with significant disparities in outcomes based on race, ethnicity, socioeconomic status, geographic locations, cancer type, age, and sex. Moreover, as you heard, treatments employed are associated with severe, acute, and long-term toxicities. More than 2/3 of the survivors of childhood cancer experience treatment-related health and psychosocial problems that significantly impact on their day-by-day quality of life. And since the number of newly diagnosed patients is projected to increase of approximately 2% each year in California, so it's this issue is left unaddressed, the rate of physical, emotional, and financial burden to cancer patients, as well as the economic burden for our communities, will increase exponentially in the coming decades. As you know, California's population of more than 39 million people is the most ethnically diverse in the country, and approximately 12% of the estimated 16,000 children diagnosed in the United States lives in California. Therefore, by providing funding to qualified research institutions to support pediatric cancer research, SB 934 will accelerate the pace of discovery, improve outcomes, and decrease treatment-related toxicity of children and adolescents with cancer, as well as the economic burden to the California communities. Furthermore, I believe that promoting pediatric cancer research in California will also provide unique opportunities to address the disparities in outcomes in childhood cancer locally and nationally. Again, thank you very much for the opportunity to talking with you, and I hope that you will find in your heart ways to support this project. Thank you.
Thank you so much, Dr. M, for the work that you do every day for this community and for all the children and families that you serve. Thank you so much. And thank you for taking your time out of your time in the clinic today to join us and support this. So thank you. I'm actually going to turn it over now to Kristen Moore, as Dr. M mentioned, and her daughter Scout, to tell you about their journey and also underscore the importance of why we are doing this work today. So Kristen, I turn it over to you.
Thank you, Aubrey. And I'd like to take a moment first to thank Senator Rubio and Assemblywoman Rubio again for their support of this bill. My name is Kristen Moore, and my daughter Scout was diagnosed with acute lymphoblastic leukemia in January of 2019 at the age of 3. We are incredibly lucky that she is now nearly 1 year off treatment with a clean bill of health. Before my daughter's diagnosis, the only in-depth knowledge I had about cancer treatment was related to adults. In fact, my grandfather had just completed lung cancer treatment before Scout was diagnosed. And I remember back to his treatment and just thinking how innovative and cutting edge it was. He had laparoscopic surgery and he didn't even need chemotherapy or radiation. During the first initial dark days after diagnosis of my daughter Scout, I sort of leaned back on that hope that her treatment would be just as easy and optimistic as his was, but that turned out to not be very true at all. One of the first incidents that really got me interested in advocating for additional pediatric cancer research was when my daughter had an anaphylactic reaction to one of the chemotherapy drugs administered to her. This was amazingly not a surprise. It was not a shock. Before the drug had been administered, her treatment team had warned us that a high percentage of children do have an anaphylactic reaction to this drug. And I just want to pause for a moment to illustrate how insane that is, that cancer families are asked to give drugs to their children that might kill them as a side effect. If anyone has ever witnessed their child have an anaphylactic reaction, it's of course very disturbing to see the hives spread all over their body. They begin wheezing, they cannot breathe. But when that child is also a cancer patient, it is even more horrific. Watching the nurse slam an EpiPen into my daughter's frail body was definitely one of the most traumatic moments of her treatment for both my daughter and myself. We were lucky enough that her treatment team told us that there was a replacement drug because unfortunately my daughter was supposed to receive additional doses of the drug she was allergic to. And so when we began the replacement drug, we were at first optimistic, but that in turn became a very difficult ordeal for us as well. The replacement drug consisted of a series of shots in her legs. And as you can imagine from the EpiPen incident, my daughter was a bit terrified of additional shots in her legs. Additionally, the shots were excruciatingly painful. I remember my daughter begging and pleading to not let them do this to her. She wanted me to protect her so that she did not have to go through this ordeal. And there is nothing more heartbreaking as a parent than to look in your young child's face, so trusting and loving, and tell them you must hurt them in order to save them. Unfortunately, beyond just this pain and difficulty, my daughter also had a hypersensitivity to this drug. So it caused very high levels of ammonia to build up in her blood, stressing her liver, and potentially leading to additional side effects like coma or permanent brain damage. And so my family was forced to make a decision. We could continue with this drug treatment that had the potential to have irreparable damage to her internal organs, or drop this portion of her treatment and risk that she would not ultimately beat leukemia. There was no third option. After that experience, I knew that additional research was so needed so that California's children could have more treatment options that are not so damaging to their young developing bodies, treatment options that do not lead to mental or emotional scarring or adverse childhood experiences. And right now, California is at a perfect position to enable that research. We have some of the best research institutions in the nation, including UC Davis, where Scout was treated. And with our current budget surplus, we have a unique opportunity to fund research that could hugely impact children with cancer, like my daughter Scout. And for all of those reasons, I strongly support SB 934, and I hope you all do as well. So thank you for your time today.
Thank you so much, Kristen, for sharing your story, for sharing Scout's story, and for underscoring the emphasis on why we need more options for treatment and why we need less toxic treatments. I'm going to turn it over now to Patty and Ethan Davis, another set of advocates that we've had along our journey here in making a difference in California, and honored to turn it over to them to speak to their childhood cancer journey.
Hi, my name is Patty Robbins, and my husband Ethan Davis and I live in Mill Valley, California with our 2 children. I'd also like to start by thanking Senator Rubio and Assemblywoman Rubio for championing and supporting SB 934. And I'd also like to thank our friends at the American Childhood Cancer Organization, Aubrey and Jessica, for partnering with us on this journey. Our daughter, Leanna, who is now 2.5 years old, is a cancer survivor. On March 6, 2020, I brought our 5-month-old Leanna to the pediatrician because her belly felt hard. By noon that day, I was in the ER holding Leanna as she received an ultrasound. And I remember the ultrasound technician using the word tumor, which felt unreal and impossible. The next step was a CT scan, and it felt like an eternity until we heard the results later that day. Our 5-month-old baby had cancer, and our tiny baby had a tumor the size of a grapefruit. The days that followed felt like centuries as the information came in drips and drabs. Leanna went under anesthesia for a biopsy of the tumor, and she had a central line inserted at the same time because we knew no matter what type of cancer she had, her treatment would involve chemotherapy.
So we soon learned that Leanna had hepatoblastoma, a pediatric liver cancer that afflicts and kills children around the United States and the world. Our doctor explained the treatment options, which involve the same multiple drug cocktail of chemo that has been used for decades. The side effects are horrific, including nerve damage, heart damage, hearing loss, kidney damage, and much more. Hearing this, we pushed the doctors for other options, but aggressive chemotherapy was the only option. We did manage to enroll Leanna in a clinical trial involving less chemo, where she was treated with only one type called cisplatin. But although Leanna would be exposed to fewer chemo and therefore would hopefully suffer fewer side effects, it was a little bit cold comfort given that cisplatin itself has serious and lifelong side effects, most notably permanent hearing loss. But we knew this was a risk we had no choice but to take. And so in the spring and summer of 2020, Leanna completed 5 rounds of chemo, and sitting by your 6-month-old child's side in a hospital for hours, watching chemo drip into her veins is something that I hope no one has to go through. After that, she had a major abdominal surgery to remove the tumor. It was successful, and we're forever grateful to our superb oncologist and surgeon. And Leanna went into remission. But after treatment, hearing tests confirmed that we weren't going to get lucky on that front, and that Leanna's hearing had deteriorated and hearing aids would be necessary for the rest of her life. We're here today because we want to do everything that we can to save other families and other children from what we've gone through. This country is capable of developing groundbreaking vaccines and effective treatments in record time. Just look at what we've done for COVID-19. And cancer kills far more children than COVID does. With investment in clinical trials and research, we think the darkness and devastation of this diagnosis today can give way to a hopeful dawn to come.
So now, 2 years later, after her diagnosis, Leanna is doing well and has no evidence of disease. She visits the oncology team at UCSF every 3 months for an ultrasound and lab work, and so far she remains in remission. But we continue to live in fear of a relapse. These visits will continue until Leanna is 7 years old. Leanna wears hearing aids and participates in an early start program in Marin County for children with hearing loss, where she's learning, growing, and thriving. We wanted her to just come in and say hello, so you can see for yourself that she's doing well. We're immensely grateful for how well Leanna's doing, especially given what she's overcome. But we do believe she can and that we can do better for our children. The lifelong side effects of chemotherapy are particularly acute and impactful for children. We strongly support funding California-based research efforts geared towards not only beating cancer, but also minimizing lifelong side effects. We are beyond thrilled to support SB 934, and we hope that you will too.
Thank you so much, Patty, Ethan, and beautiful Leanna. Honored to have you guys sharing your story and doing the work that you do alongside these advocates that we have in California on behalf of SB 934 and the budget appropriations as well. So thank you guys so much for taking the time to share your story today. Love seeing Leanna. Going to move now to Dr. Joseph Wiemels, who is the professor at the Center for Genetic Epidemiology at the Keck School of Medicine at the University of Southern California. We're honored to have him speak with us today, presenting some of the disparity work and amazing work that he does on research in this state. So Dr. Wiemels, I turn it over to you.
Okay, thank you so much, Aubrey and Jessica from ACCO for getting the ball rolling for us here in California. And like everyone else, I'd like to thank Assemblywoman Rubio and Senator Rubio for partnering with all of us, and we're all behind you 100% for SB 934. I'm a molecular epidemiologist, so even though I work at a medical school, my career is 100% devoted to keep people away from the medical school or away from the hospital to try and study the causes and prevention of childhood cancer. I chose to study childhood cancer because children have, they least deserve this diagnosis, and they have the most of life ahead of them. And why shouldn't we target more resources on this population? As you've heard today, children in California have the highest rates of childhood leukemia compared to around the country. And not only that, this leukemia is increasing 1% per year in incidence since the 1970s. And this increase has been the greatest in California Latino families compared to other racial ethnic groups here in California and around the country. Because of this increase, we know that cancer is not inevitable. There must be something in the environment that's causing it, and it's our goal to try and find this cause. We have some really unique resources here in California to study cancer. One is our longstanding childhood, it's Cancer Registry. It's for all cancers. Goes back to 1978. It's been a gold standard registry for that whole time. We also have a great vital statistics registry, that's the birth registry, and the California Biobank, which stores samples that can be used for researchers for up to about 24 million children who have been born in the state so far. We and others have been using these resources to understand characteristics of childhood cancer. One thing that we found out is that cancer clustering within families is much higher in ethnic groups besides the non-Latino white population. And this is something that's just been appreciated for the first time because registries, large functioning cancer registries have only been available in California that have a multi-ethnic population. Other studies that have published these in the past are out of Scandinavia, where the populations are entirely a single ethnic group. So yeah, and we found that Latinos, Blacks, and Asians all have this higher rate of cancer clustering within families. So it's our goal to understand what is causing this clustering, what are causing these higher rates. Is it genetics? Is it the environment? It's most likely a combination between the two. And if we can figure out who it is who has this higher susceptibility and what it is causing it, we can prevent it in the future, and that's our goal. Thank you.
Thank you so much, Dr. Wemos, for your information and underscoring the importance of why we're doing this work. And thank you for the work that you do every day so that, as you said, we keep people out of the hospitals. Thank you. Next, I'm actually going to turn it over to a video from Senator Max Wise from Kentucky. As I mentioned at the intro, the American Childhood Cancer Organization has been doing this work at the state level for a few years now. And we actually have taken this from what Kentucky spearheaded years ago. So we have a message from Senator Wise from Kentucky as our next step here.
Hi, I'm Kentucky State Senator Max Wise. I just want to thank you all for the advocacy that you're doing for childhood pediatric cancer research across the entire United States. We've done a great effort here. In 2015, we passed Senate Bill 82, which established our Kentucky Pediatric Research Trust Fund. And in 2018, we were able to establish in our biennial budget $2.5 million that would go towards helping pediatric cancer research. I appreciate Jamie Bloyd, all the work that she's doing, advocating across the country. I want to thank you all that are in California. If you're a legislator, if you're a lobbyist, or if you're a philanthropist or a family member, greatly appreciate the work that's going into helping the families across the entire United States. Once again, thank you all so much for your advocacy and your voice.
So thank you, Senator Wise from Kentucky. They've been able to do great things with that research funding, and now Pennsylvania, New Jersey, and then this year Maryland are following in those footsteps. And we know that California has the power to do that next as well and lead this country. I'm actually going to, now we're going to look at the chat. If there's any questions you haven't put in, if you want to put those in now, we can go through those. My counterpart, an amazing leader in California with me, Jessica Beckstrand, also from the American Childhood Cancer Organization, is going to manage the chat. If there are any questions, Jessica, that you want to ask to any of the panelists from the chat, let us know now.
One moment here, I do have a question that was asked, and I think Dr. M answered it via the chat here. Shannon asked, are the rates of adverse reactions to treatment higher among children than they are among adults? Dr. M or Dr. Wemos, can you elaborate on that perhaps?
Oh, Dr. M, I think you're on mute.
Yes, sorry.
Okay, there you go.
So
No,
some of the drugs for which our children show so much allergic reactions are really very, very important in the treatment of lymphoblastic leukemia. But due to its toxicity, are usually not well tolerated on older adolescents and young adults. So we have been lucky to be able to use it in the pediatric fight against lymphoblastic leukemia. But unfortunately, because of that, our children are the ones who experience all these toxicities and all these allergic reactions.
Thank you, Dr. M. I appreciate you. Another question is, I believe was answered here, but I'll repeat it here, is please repeat the total number of pediatric cancer patients in the United States and the percentage of those who live in California. And Dr. M, thank you for answering that. It's approximately 12% of the estimated 15,780 children diagnosed in the United States live in California.
Great, thank you for that, Dr. M. Jessica, are there any other in the chat? I think that's it.
Yes, there's one more
there is.
that we can get to, and then we'll have to close up here. Besides contacting our lawmakers, what can we in California do to help support SB 934? Aubrey, do you mind taking that?
Yeah, no problem. And of course, if the Assemblywoman Rubio or Senator Rubio want to chime in also. But I think for us, yes, contacting your legislators to make sure show your support and underscore the importance of addressing this specific initiative is huge. And actually, Jessica put in the chat, we have a quick link that everybody can use to show your support through your legislators. But to answer the question of outside of that, what we also look at ACCO is just building the awareness for the cause, because the more chatter there is about it and the more awareness there is to the childhood cancer, the uniqueness of the journey and the needs of this community, the more work we can get done to help not only with research funding, but so many other things. So you can take to social media. You can take to your community, talking to maybe your mayor, talking to friends and family members. But I think in this day and age, social media is such a powerful tool, but showing, either going gold for childhood cancer or just speaking to childhood cancer as a cause is so impactful to build that awareness. And I used to be like, oh, what does awareness do? But I've seen it help us in multiple states. As that awareness grows for childhood cancer, more and more things get done at the state level to build resources for families, to build resources and funding for research so we can find less toxic treatments, have more children surviving, and have that survivorship be even better off because they had less toxic treatment. So I would say social media and building that awareness out there.
And to piggyback off of that, social media, you can follow the American Childhood Cancer Organization on Facebook, Instagram, Twitter, LinkedIn, as well as Senator Susan Rubio on the same platforms.
Perfect. Thank you so much. And just to be respectful of time, I know we need to wrap it up. First and foremost, I would love to thank Senator Rubio for your support in championing this, and then also Assemblywoman Rubio for championing this on the Assembly side. So thank you both for this initiative and taking this on, as well as all of our panelists that we had today, doctors that you took your time out of your busy days helping children to speak on behalf of this cause, and all of the advocates that we have on here. Kristen, Patty, Ethan, Leanna, Elke, I know it's not easy to share your story, especially on a platform like this, but thank you so much for taking the time to do this, as well as all of those of you out there that did tune in to hear more about this initiative, and those that have been advocating with us for the past year on behalf of this in California. Honored to have you with us, honored at everybody's efforts for this initiative. Jessica, again, put in the chat the link that you can use to show your support to your legislators. And also, if you just go to acco.org, there's a way to take action at the state level. And we'd love to have anyone join our team alongside these great advocates to make a difference in California. And again, we're here on behalf of SB 934, which is the Andrew Hirschman Childhood Cancer Research Fund, and the $50 million direct appropriations from the governor's budget so we can set up consistent and stable funding and make a difference for the childhood cancer warriors and their families in California, and those that are going to be diagnosed in the future as well. We're here to make a difference for them together. So thank you everyone on the call, and especially our panelists and our champions. And I hope everyone has a good day, and thank you for your support.